And representatives from across Africa gathered in the Sahara city of Dakhla, Morocco, to discuss South-South cooperation for health sovereignty. The consensus is Africa must craft its own solutions to the continent's pressing healthcare challenges. Trust TV's Sumayya Abubakar brings details.
Africans in all over the continent meet in Dakhla, Morocco, for the sole purpose of a great invitation by Mohammed VI Foundation that created the African Academy of Health Sciences for the full purpose of creating democracy for the African continent in terms of healthcare services. This initiative embodies unity and collaboration among Africans to bridge gaps in the continent's healthcare development through education, research, innovation, vaccine production, and information sharing. African leaders hail it as a visionary project, emphasizing its potential to improve healthcare systems tailored to Africa's cultural needs.
We
call for integration, shared priority, and scientific innovation to serve the continent. With this initiative, there shall be no country left behind. Africa should invest in research to find medical solutions that can be adaptable to socio-cultural economic environments.
We really need to keep focus on this kind of initiatives because the secret of our development will come from this kind of initiative.
So we can together build a new health system for Africa in terms of training for people, for young researchers, but also in terms of vaccine sovereignty, in terms of competence and capability for Africa by Africans.
Amid Africa's struggle with brain drain, poor healthcare infrastructure, inadequate funding, power shortages, and demographic pressures, this initiative is widely recognized as a vital step toward addressing the continent's challenges.
This seriously, our highly educated human resource people that we train for so many years and who are so few, if we are seeing them going to look for greener pastures somewhere else, now we should look at ourselves and say, okay, let's see what little we can do for these people to retain them so that they serve us. But
when we take the case of Europe, for instance, they don't have malaria, and it's Africa that suffers of this disease. Do you think, if we deeply think, are they able to give appropriate training to our students or our experts? I'm not sure.
Panelists from across Africa have called for greater continental alignment and urged political leaders to demonstrate the will to tackle the continent's shared challenges with unified solutions.
We should pay more attention. We should allocate more of our national budgets on the health sector because health sector is very important. Without health, nothing can work.
As West, East, North, and the South Africa meets in Morocco, we are all reminded of the critical role that we all need to play to make a better continent for ourselves and take the continent to a higher level. From Dakhla in Morocco, Sumayya Abubakar.